Welcome back. We're heading into flu season, and right now many physicians recommend you getting that annual flu vaccine. Studies show that only about half of Americans get that vaccine annually. And today we have Dr. Lisa Doggett joining us with Dr. Gregg Sylvester. Thank you both of you for being here. Dr. Gregg Sylvester, what are some of your upcoming concerns for this flu season?
Well, I think the biggest concern is that what we're seeing in the Southern Hemisphere is going to be repeated in the Northern Hemisphere, and particularly here in the United States. We've seen an early and a severe flu season in the Southern Hemisphere. And it's not just in one or two places. It's in Australia, Argentina, Brazil, Chile. It's in South Africa. So what we know is that viruses don't stop at the equator. They circulate around the globe. And if we're not all vaccinated or we don't increase our vaccination rates, we could experience a severe flu season the way that our people that are in the Southern Hemisphere have experienced.
Dr. Doggett, why is getting vaccinated for this flu season more important than ever?
Well, I think it's important to get vaccinated against flu every year, but this year in particular is a concern because, as Dr. Sylvester explained, we're looking at the Southern Hemisphere, and we know that that may predict what we will experience here. We're also concerned because we know that we've changed our behavior over the last couple of years to help reduce the risk of COVID, and now we're starting to change back. So we're not wearing masks so often now. We are not social distancing very much. We're gathering more together indoors. And because of that, we're at higher risk for all kinds of infections, in particular flu. We know that right now is the best time to get vaccinated against flu. September and October are the recommended months. And it's important to get those COVID booster shots as well.
Dr. Sylvester, what are some of the key lessons learned from recent flu seasons?
Well, I think the last two flu seasons, we learned that those mitigation strategies worked for COVID, but they also worked for influenza. But I think the more important lesson is that there is a vaccine to prevent influenza. The Centers for Disease Control and Prevention says the number one way of preventing flu is to get an annual flu shot. It not only helps the individual, but it can help the entire community. We're here on behalf of C-S-L Seqirus to talk about the importance of getting an annual vaccine now, next year, and the years to come.
Dr. Doggett, are some individuals more at risk for flu than others?
So anyone can actually get a flu infection, but we know that some people are at higher risk for complications. In particular, people who are older, usually over 65, are at higher risk for having a serious outcome from flu. Kids as well are at higher risk. So kids, particularly under 5, as well as people with other health conditions such as diabetes, heart and lung problems. Those folks really need to be vaccinated. Everyone in their household needs to be vaccinated. And then all of us want to do, we need to do our part to protect ourselves as well as the more vulnerable people in our community.
Dr. Sylvester, where can we go to learn more, especially as we're heading into this flu season?
Well, I would encourage them to all go to flu.com. I think they're going to find some really important and good information there. But don't forget, any healthcare professional, and clearly your primary care physician, can give you the important information you desire.
Well, thank you so much, Dr. Sylvester and Dr. Doggett, for joining us today. Appreciate this important information about flu season and getting the flu vaccine. We'll be back with more right after this.